Hello, this lecture is part one of two in the chapter Healthcare Professionals and Interdisciplinary Care. I'll be doing part one while Dr. Michael Oldani will do part two. This first part focuses on the data and demographics on some healthcare professions, while part two will focus on interdisciplinary care and interprofessional education. As mentioned in our introduction, here is the complete layout of our healthcare system. And we see professionals, various professionals, a variety of professionals and disciplines make up healthcare and all need to work collaboratively to work and improve individual and population outcomes. This is the most recent data available from the Bureau of Labor Statistics on various professions. Pharmacists, on average, go through 6 years of post-secondary education. Licensure is required in all states with limited prescribing authority. And the average 2012 compensation of $116,000 approximately. We can see that the number of pharmacists is approximately 286,000 pharmacists in 2012. Although the minimum is 2 years of undergraduate and 4 years of pharmacy school, usually a typical pharmacy student has done more than 2 years and sometimes has a 4-year Bachelor's of Science degree or Bachelor's of Arts. Pharmacy technicians play a crucial role in the delivery of pharmaceuticals and medications. What is a pharmacy technician? An individual working in a pharmacy who, under the supervision of a licensed pharmacist, assists in the pharmacy activities that do not require the professional judgment of a pharmacist. So the responsibilities can vary between states as well as the regulation and training. Their pharmacy technicians are employed in community and hospital settings. There is no higher education degree requirement, meaning no associate's degree nor bachelor's degree is needed to become certified or to work as a pharmacy technician. In fact, certification of pharmacy techs can vary among states. In Wisconsin, there is no requirement right now for a particular certification or examination. So the two certifications that a certified pharmacy tech can undergo in other states other than Wisconsin is through either the examination for the certification of pharmacy technicians or the pharmacy technician certification exam. So the biggest concern that you'll need to address is which organization is accepted in your state, which leads us into the second big difference between these two certifications. So the PTCE is more widely recognized and endorsed. It has been around longer and therefore more established. However, there isn't any evidence that one is more difficult than the other. Some speculation has been mentioned on discussion boards that the accept is more geared towards retail pharmacy and the PTCE is split more evenly with hospital pharmacy. Obviously, quite a difference between pharmacists and technicians in education, licensure, responsibility, and compensation. Interestingly, technicians outnumber the pharmacists, with pharmacy technicians numbering approximately 335,000. Physicians are the major decision makers, deciding on courses of treatment for patients' admissions to and discharge from inpatient facilities, medicines prescribed, and other aspects of care. However, with the advent of healthcare reform and with the movement towards interdisciplinary care and interprofessional education, physicians are just one of the team members in a collaborative practice. They take the Hippocratic Oath, which its main tenet is first do no harm. You can see the Hippocratic Oath image there on your right. They have to be licensed in all states, passing the USMLE examination requirements. There are general practitioners and family medicine specialties versus other specialties and subspecialties, which you'll become well versed throughout your whole pharmacy school as you work with some of these specialists in your internships experiences. Most physicians do graduate with an MD degree versus the DO degree. There are just more allopathic schools versus osteopathic schools. Once both of these two degree holders advance to residency, they are practically equal. Physician education, either the allopathic MD degree or the osteopathic DO degree, requires a 4-year undergraduate degree. Again, most are 4 years of medical school. However, 3-year programs are being studied. In the traditional 4 years, it's usually the first 2 years are the basic sciences, and then the last 2 years are the clinical rotations. Residency is usually required that range from 3 to 7 years, depending on the specialty or subspecialty of interest. And the first year is usually referred to as an internship. And then most work in their chosen specialty, whether it be general practitioner, family medicine, versus many of the specialties that many of you will learn through your pharmacy education. So the pharmacy education, when contrasted with that with physician education, is considerably shorter. However, there are residency options with respect to pharmacy as well. You can focus on residencies in ambulatory care, geriatrics, psychiatry, and a plethora of other residencies that you will, again, also learn in your pharmacy school education. Physicians do have longer educational requirements, at a minimum, about 11 years to complete, including residency. Licensure is needed in all states, as well as prescribing authority is their main focus with respect to medication therapy management. Compensation, on average, $187,000 is their average compensation. And as far as the quantity or the number of physicians, they number almost 700,000. Physician assistants, they perform many medical practice functions under the supervision of a physician. The typical number of years required is 6 years, which is 4 years of an undergraduate degree and then 2 years of PA school. You can be licensed after you take the Physician Assistant National Certification Examination. Concordia University has a PA program. By the number, there is licensure required in all states. They do have prescribing authority, and their compensation on average is $90,000. As far as the quantity and the number of professions in physician assistants, it's approximately 90,000. Nurses comprises the largest healthcare occupation, numbering almost 2.7 million. They are responsible for a variety of clinical care, administrative care, patient care. There are multiple levels that are associated with educational requirements, with LPN, RN, and APN degrees. As advanced practice nurses, these are mainly graduate level education, meaning that they have completed some level of bachelor's level nursing to advance to a master's of science, as well as a doctorate of nursing practitioner. Nurse practitioners have prescribing authority depending on the state, and there are many specialties available, including midwives and anesthetists. You may have heard that anesthetists have high salaries relative to their other nursing specialties. So the RN is licensed after passing the NACLEX. Nurse practitioner license also requires an examination board. Here's a typical timeline of completions of nursing education. As mentioned, bachelor's in nursing is usually a 4-year degree, which is typically the RN. And then the master's is being phased out so that to focus on the education in the doctorate of nursing practitioner. As far as compensation, nurses make on average approximately $65,000. Again, as far as the quantity and the number of nurses, approximately 2.7 million nurses. In physical therapy, therapists help improve the mobility of a person with physical disabilities to relieve pain and to prevent or limit the extent of physical disability. In practice, about approximately 47% are in ambulatory care, 33% in hospitals, 20% in home health and long-term care. Licensure is obtained after passing the National Physical Therapy Examination. Education is usually at a minimum 6 years, however, it's transitioning to 7-year doctoral degrees. And there are multiple board certifications and specialties, and there are approximately 6 of them. As far as compensation, physical therapists make approximately $80,000, and notice that they usually do not have any prescribing authority. Physical therapists number approximately 200,000. Occupational therapists work with individuals who suffer from a mentally, physically, developmentally, or emotionally disabling condition to improve their ability to perform tasks in living and working environments. Just as an aside, Concordia has both of these two programs, physical therapy and occupational therapy. The focus of therapists in practice, approximately 32% are in hospitals, 30% in ambulatory care, 17% in schools settings, 21% in home health and long-term care. Minimum degree is a master's level. There are doctorate level occupational degrees, which is the way that the profession is moving towards. Licensure is after the National Board for Certification in Occupational Therapy. The average compensation for occupational therapists is approximately $75,000. They do have, just like the physical therapist, both the physical therapist and occupational therapist usually do not have prescribing authority. there are approximately 113,000 occupational therapists. Social workers assist people by helping them cope with and solve issues in their everyday lives, such as family and personal problems and dealing with relationships. Also, social workers are very integral to the healthcare system as they also help try to navigate a patient. For those patients who can't navigate the healthcare system, a social worker can be very helpful. So they might assist patients and families in dealing with disability, disease, substance abuse, housing issues, domestic conflict, abuse, and much more. The minimum is a bachelor's degree, but many are master's level trained. At Concordia, there is both a bachelor's and a master's of social work, which is a new program. So licensure can vary quite a bit and can be employed in multiple sectors, including in the healthcare, in mental and substance abuse, as well as approximately 43% in mental health substance abuse institution and 15% are in hospitals. The average compensation for social work is approximately $56,000, and there are approximately 119,000 social workers. Again, this is just a recap of the profession and how many years it takes to complete such an education, with licensure approximately being required in all states and prescribing authority limited to primarily physicians. And then by the number, understanding that healthcare is an area of growth. So all of these professions will always be in demand, some more than others. And as healthcare reform progresses, the demand can change as a result of the change in responsibility and effectiveness of these healthcare professions. I'm going to end with this last slide, which I believe Dr. Oldani will start. But as you know, you at Concordia University, Wisconsin, have various options with respect to a particular health profession. We have nursing, occupational therapy, physical therapy, pharmacy, physician assistant, social work, and these last two have been talked about in the past: optometry, public health, and even chiropractic.